Venezuela has confirmed 8 new COVID-19 cases for a total of 189. Hundreds of bodies of COVID-19 victims have been removed from homes in the Ecuadorian city of Guayaquil, the epicenter of the outbreak in Ecuador. Lesotho and the Island Nation of Comoros are the only two African nations to remain free of the COVID-19 virus. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Venezuelan Vice President Delcy Rodriguez offered a daily report on the efforts coordinated by the Presidential Commission for the Control and Prevention of COVID-19.
We have noted that with these 8 new cases, of which we have offered details, Venezuela has reached a total of 189 cases at the national level, fortunately maintaining the flattening of the curve.
And the Venezuelan Vice President also announced that the country leads the region in terms of COVID-19 early detection tests.
We also want to inform the population that Venezuela, as the leading country in Latin America in terms of applying the widest range of tests, today has already conducted 203,108 tests. This gives us a figure of 6,873 tests per million inhabitants. Again, this number places Venezuela as the leading country in Latin America and the Caribbean in terms of the number of tests carried out, which has allowed us to take important steps in prevention and this expanded and personalized early detection process, which is based on mass detection, on which the COVID-19 control and prevention process in Venezuela is based.
Healthcare professionals in Colombia are calling on the state to provide protective equipment following the deaths of 2 doctors and an ambulance driver in the midst of the coronavirus epidemic. On Sunday, Colombian health personnel rejected a decree issued by President Ivan Duque, which orders all health personnel, and even those still undergoing their professional training, to treat COVID-19 patients without the minimal protective elements to prevent contagion, as recommended by the World Health Organization. 35 trade union organizations of the country, gathered in the Coalition for Human Talent in Health, signed a public letter condemning the presidential measure and holding Ivan Duque responsible for the risks faced by those on the front line of the fight against the coronavirus. And a prison crisis has erupted in Colombia for the same reasons, as inmates claim the state is not adopting measures to prevent the spread of COVID-19 within prisons. Several disturbances have been reported, with at least 1 riot resulting in fatalities. Meanwhile, a group of prisoners has started a hunger strike to demand preventative measures, while the Colombian Ombudsman's Office has called on the Ministry of Justice to implement an emergency measure to save the lives of thousands of prisoners and prison workers. The number of novel coronavirus cases in Latin America continues to rise. Brazil continues to be the hardest hit country in the region, with a total of 22,720 COVID-19 cases and a death toll of 1,270. Brazil ranks 14th in the world in terms of the number of cases reported. Meanwhile, Ecuador, with over 7,500 cases, remains in second place in the Latin American region, despite having a population 12 times smaller than Brazil. Chile follows with more than 7,000 cases. Peru and Mexico come next in the region with over 7,000 and over 4,000 cases respectively. Panama continues to be the worst affected Central American country with 3,400 cases. And in the Caribbean, the Dominican Republic has reported the highest number of COVID-19 infections at over 3,100. The Ecuadorian Health Ministry has reported around 7,000 COVID-19 cases and an official death toll of 333. But local reports indicate that the real figures could be much higher. Our correspondent in Ecuador, Denise Herrera, brings us more on the latest government measures to face the economic impact of the virus.
Ecuador has now around 7,000 cases of the new coronavirus, and around 300 people have died because of this new virus. The Ecuadorian authorities have also informed economic measures. The president of Ecuador, Lenin Moreno, recently announced that he will create a new national account to face the sanitary crisis. Moreno said that all Ecuadorian citizens who have a salary more than $500 have to give a special contribution, as well as the public workers who have to give the half of their salaries. Several social organizations of workers have rejected these new economic measures. They said that Moreno are also benefit the private sectors. We should remember that organizations of workers have been rejected this agreement before between the IMF and the government. In this context, also the authority who are leading the removal of the bodies who have died because of this new virus said that around 1,000 bodies of people who have died because of the new coronavirus have buried. In this context, are still the citizens from Guayaquil denouncing that these numbers are not official, are not the truth. They are still announcing that the government didn't help them, and they are claiming help. They want to give to their relatives a dignified buried. In this context, so the government said that they are taking all the preventive measures to stop with the spread of this new coronavirus. Meanwhile, different social sectors are saying that the government is not saying the truth.
The Cuban Foreign Ministry this Monday presented a diplomatic note to the United States Embassy in Havana, rejecting accusations of an alleged drug trafficking operation between Cuba and Venezuela. On Monday, the Ministry of Foreign Affairs officially rejected the information published in US magazine Newsweek, where an unnamed senior Pentagon official claims to have evidence of drug trafficking between Venezuela and Cuba. The Cuban authorities stress that the US government and its specialized agencies have more than enough evidence to debunk such claims. According to the note, Washington is fully aware that Cuba has a zero-tolerance policy regarding drug trafficking and actively participates in regional and global initiatives and programs to tackle this problem. The Cuban authorities contrast the recent accusations with the 2020 International Narcotics Control Strategy report by the US State Department, which recognizes that Cuba is not a major consumer, producer or transit point of illicit drugs. A second group of Cuban medical personnel has arrived in Turin, northern Italy, to support the efforts to contain the coronavirus. The latest medical brigade was welcomed by the city's mayor and other Italian authorities. The first medical brigade sent by Cuba to Italy arrived on March 22nd and has been working at an emergency hospital in the town of Crema, Lombardy, to support overstretched local hospitals in the worst-hit region by the COVID-19 epidemic. Over the weekend, the Cuban government also sent a medical brigade of 11 doctors to the West African nation of Togo to support its fight against the coronavirus. This is the first time Cuban medical personnel have been deployed to the country, and the move came in response to a request from the Togolese government. According to WHO figures, Togo has reported 77 cases and 3 fatalities. More stories coming up after this very short break, so don't go away. Welcome back to From the South. The number of coronavirus cases continues to rise in the United States, now the center of the pandemic. The US has now reported more than 577,000 confirmed COVID-19 cases and over 23,000 deaths. According to a top US health official, the country is nearing the peak of its coronavirus outbreak. Around 2,000 fatalities have been reported for the past 4 days in a row, the largest number of them in and around New York City. New York State Governor Andrew Cuomo announced the state's coronavirus death toll has surpassed 10,000. Cuomo warned against easing social distancing restrictions too quickly, as President Donald Trump reportedly seeks to reopen the economy by the end of the month. Cuomo stressed the state authorities would listen to experts to determine when to relax restrictions, striking a delicate balance between restarting the economy and still protecting public health.
That raises the death total to 10,056. Again, for perspective, 2,700 lives were lost in 9/11, and 9/11 changed every New Yorker who was in a position to appreciate on that day what happened. Not as bad as it has been in the past, but basically flat, and basically flat at a horrific level of pain and grief and sorrow. This is 671 people who passed away on Easter Sunday.
And our correspondent in the US, Jorge Gestoso, brings us more on the contradictions between President Trump and other officials regarding the lifting of measures to combat the spread of the coronavirus.
Thank you. There are growing tensions between President Trump and the governors of the 50 states regarding the date that they want to work out regarding the reopening of the economy. President Trump pushes to be May 1st. Even inside his team, there are disagreements. For example, Dr. Fauci has already said that it could be too early, that has to be taken step by step. And also he has criticized President Trump and his government, saying that an early response could have saved lives. That has created a lot of tensions also between Dr. Fauci and President Trump, so much so that President Trump has retweeted a tweet that was ended up with the hashtag #FireFauci. On the other hand, there are people in this country that this week started to get already the $1,200 check as a part of the stimulus plan. They are getting it through directly their bank accounts. People who are not having that information by the IRS are going to get it by mail. I could get them by the end of this month or even later. In terms of the death toll, we're talking about 23,000 people and about 575 confirmed cases of contagious, but they believe that the figure should be much, much higher because only about 1% of the population has been tested. So the situation in terms of New York City, that is the epicenter of the pandemic, is getting a little bit better in terms of hospitalizations and in terms of people in their ventilators, but not necessarily that is a reference for the rest of the country. We get back to you now.
The Spanish government distributed 10 million face masks to commuters at major train and subway stations this Monday as some workers returned to work after 2 weeks at home. The focus is on factory and construction workers among those returning to work in Spain, while office workers are strongly encouraged to continue working from home. However, the lockdown remains in place for at least 2 more weeks under the current state of emergency declared by the government on March 14th. As well as handing out masks to workers who need to use public transport, private security firms will ensure that people maintain a safe distance during their journeys. Spain has over 166,000 confirmed COVID-19 cases and has reported more than 17,000 fatalities. The number of confirmed COVID-19 cases worldwide has now surpassed 2 million, according to the latest data provided by the Johns Hopkins University, which monitors statistics internationally. As such, the number of people infected by the coronavirus has doubled in just 10 days. Meanwhile, in Europe, the hardest hit region in the world, some governments are considering lifting lockdown restrictions. More details in the following report by CGTN's Ira Spitzer for Telesur in Berlin.
European countries face difficult decisions in the coming days and weeks as they consider whether and how to loosen the restrictions on public life, which have been in place because of the coronavirus outbreak. Europe has been hit extremely hard by the global pandemic, but what we've seen in certain countries over the past few days has been a flattening of the infection curve, and that has led politicians and others to start trying to decide how to go forward with restarting the economies and getting people out of their houses and back to something resembling a normal life here in the two hardest hit countries, Spain and Italy. We are seeing some changes. Spain will allow non-essential workers, certain non-essential workers such as construction workers who are unable to work from home to, in some cases, return to the job. In Italy, some shops are now opening. We've also seen loosening of restrictions in Austria, the Czech Republic, and Denmark. Here in Germany, leaders will discuss that possibility on Wednesday. So it really is something that the continent is grappling with, but the tremendous risk here and the worry for people as well as politicians is a possible second wave of infections. So that really is the question as the countries consider their options here. Ira Spitzer, CGTN for Telesur in Berlin.
Meanwhile, China reported its highest number of new coronavirus infections in weeks on Monday. The Chinese authorities are determined to preserve the progress achieved in the fight against the COVID-19 virus, and the top priority now is to avoid a second wave of infections, as explained in the following report.
The increase in imported and asymptomatic cases of the novel coronavirus in China, which now exceed 1,000, has authorities on high alert, faced with the possibility that they could spark a second wave of infections that severely affect the achievement reached in curbing the spread of the virus.
In recent days, the number of confirmed cases in some neighboring countries has increased rapidly, and the figure of imported cases has risen significantly. Therefore, we must adopt strict measures of inspection and isolation of incoming passengers to ensure timely detection and treatment in order to minimize the possibility of a second wave of infections.
To control cross-border infections, mostly of Chinese nationals returning from other sources of infection, customs are now on the front line of the fight against the disease. China temporarily banned the entrance of foreigners and closed its land borders with Russia.
The authorities have strictly limited unnecessary cross-border movements of people. All the land border checkpoints have prohibited the exit and entry of people from countries severely affected. Strict border controls were established. The issuing of entry and exit certificates for non-essential reasons was suspended, and we advised people to avoid unnecessary border crossings, such as for tourism and to visit friends.
Regarding asymptomatic cases, the epidemiological controls on the contacts of infected people have been reinforced, and citizens are encouraged to continue to follow prevention measures like the use of face masks and social distancing.
Here, the situation is improving, but at the same time, people are advised to continue to use face masks, adopt protection measures, take their temperature, avoid unnecessary gatherings, and report any symptom of the disease.
China, which at one point of the epidemic reported more than 15,000 new cases and almost 300 deaths in a single day, is now considered to be in the control and mitigation stage of the epidemic and is attempting to return to normality. As such, the main objective today is to maintain its achievements and prevent a resurgence of the epidemic.
And we're taking one last break now, but stay with us for more. Welcome back to From the South. The Indonesian Health Ministry announced over 300 new confirmed COVID-19 cases on Monday. The latest figures bring the total number of cases to over 4,500. Speaking at a press conference on Monday, the Health Ministry's Director General for Disease Control and Prevention reported that the death toll had risen to almost 400. The total number of recovered patients has also increased to 380. The coronavirus has now spread to all of Indonesia's 34 provinces. Meanwhile, health workers have reported a shortage of personal protective equipment.
Of course we are afraid. You still have worries even when you wear hazmat suits. But if the patient is in front of your eyes, what can we do? We can step back. We can only wear raincoats and cover all the gaps. We maintain distance while giving diagnosis or interviewing patients. The examination was made short but focused, so we don't have to stay in the same room with patients. So when wearing non-standard PPE, we minimize contact.
The African nation of Lesotho has yet to report a COVID-19 case and is one of just 2 African countries to remain virus-free. However, the Lesotho government, led by Prime Minister Tom Tabane, has rolled out a series of economic measures to cushion the country from the impact of the pandemic. In an address on Monday, Tabane informed that a budget had been allocated for a disaster relief fund, with another relief fund for the private sector. Like other African countries, Lesotho has formally opened talks with the World Bank and the European Union for assistance in the face of the coronavirus pandemic. Local banks have also been directed to revise some regulations, while telecom companies are to lower their rates. The Island Nation of Comoros is the only other African country to have so far escaped the COVID-19 pandemic. And there are now over 14,000 confirmed COVID-19 cases in Africa. According to Johns Hopkins University and the Africa Centers for Disease Control and Prevention, 788 people have lost their lives to COVID-19 on the African continent, while over 2,800 people have recovered from the virus.
Police officers were instructing people to return to their homes.
The coronavirus lockdown in Liberia's capital, Monrovia, got off to a chaotic start at the weekend. Confusion reigned across much of Monrovia after an inaccurate message was shared on social media stating that the government had ordered a partial curfew rather than a full lockdown. Many residents had voiced their anger in the run-up to the lockdown ordered by President George Weah, which they claimed would do more harm than good in a country where more than half of the population lives in poverty. A similar lockdown in the capital city took place during the Ebola outbreak in 2014, which sparked riots by residents lacking food and water. Liberia has so far confirmed 50 cases of the coronavirus, including 5 deaths. Nigerian President Muhammadu Buhari announced the extension of the coronavirus lockdown this weekend. The Nigerian leader declared that the quarantine originally set for 14 days will continue in Abuja, the capital, as well as the city of Lagos and the state of Ogun, for as long as necessary. Buhari stressed that the lockdown may even be extended to more states, as the number of confirmed cases in the country has reached 323, and informed that anyone failing to comply with the measures will be arrested. The Nigerian government announced the distribution of 70,000 tonnes of grains to those most in need. 70 COVID-19 patients have been discharged so far in Nigeria, while 10 people have died. Coronavirus testing has resumed in the Gaza Strip after the Israeli regime allowed the delivery of 5 testing kits purchased by the World Health Organization. So far, health authorities have confirmed 13 coronavirus cases in Gaza, all of whom are in quarantine. Meanwhile, library volunteers are distributing books to children under lockdown in the Deir al-Bara refugee camp.
We distributed books and stationeries to the homes of the friends of the library. Given the fact that they cannot go to the library due to the current coronavirus crisis, we distribute books every Saturday and we collect them on Tuesdays. We then discuss the stories with them online. The idea of Bicycle on Life is ours came after that some people called the library and asked for books. But we weren't able to deliver it to them as the library was closed for a certain amount of time due to the spread of the coronavirus.
And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss and thank you for watching.